Hey everybody, you're watching A Physio Named Jonah. That's this guy. Numbers! I am a big fan. I've been spending more time recently talking about the field of physiotherapy and the numbers associated with it, particularly as it pertains to money. However, today is going to be different, as instead of money, we're focusing on statistics or metrics and how they are associated with rehab. In today's video, I'm going to help you understand what PVA actually is, how to calculate it, as well as what its practical implications are. If you are new to the channel, consider subscribing down below and clicking the bell so you are notified when I release new videos just like this one. I am a Canadian physiotherapist who makes videos on physio-related topics like the numbers of rehab, so if learning about this profession is interesting to you, come hang out here on my channel. We're gonna have a good time together. Let's start with the obvious. What does PVA stand for? PVA stands for Patient Visit Average. Well, at least in terms of lettering. We'll talk about the practicality of that later on in the video. This number is not trying to take into account anything other than that. It is exclusively a number. It does not take into account the type of treatment chosen, the effectiveness of that treatment, why certain things worked or didn't. It is just a number that represents the number of times that patients come in for treatment. I think that seeing how we calculate PVA helps to understand what it actually is, so why don't we jump into the numbers right now. In order to calculate PVA, nice and simple, we just need two numbers. We need, for a given period of time, how many first visits or patient assessments were performed within that time, and then how many follow-up sessions or treatment sessions were booked in that same period of time. Let's say for our first example here that in a month I saw 200 patient visits total. Looking at my own numbers, this is within the ballpark of normal. 25 of those were new assessments or first visits, and 175 of those were treatment sessions or follow-up visits. We now have the two numbers we need. We just need to divide the number of treatment sessions or follow-up visits by the number of first visits or assessment visits. This means that we divide 175 patient follow-ups by 25 patient assessments, which equals 7. Therefore, our PVA, or patient visit average, for that month is 7. That's it, that's all. Very easy number to calculate as long as you have the number of total visits that you do with patients, which, if you work in private practice healthcare, I highly recommend that you do. Wow, a 7! What does it mean? Let's talk about what this number actually means versus what it often gets represented as. What this number 7 means is that in that month or given period of time, you performed 7 times as many treatment sessions or follow-up sessions as you did first visits or assessment sessions. That's it. On average, for every 1 assessment that month, there were 7 follow-ups that were in your schedule. What this can often get represented as is that in that period of time, you had your patients come back into the clinic 7 times for each assessment that was performed, which I get sounds like a semantic difference, but I'll explain further what I mean. PVA, and the number 7 in this case, represents a direct ratio, not an actual measurement of patient follow-through. It means that in that period of time, there were 7 times as many treatment sessions as assessment sessions. It does not mean that each patient that came into the clinic came back for 7 follow-up sessions. Just to hammer it home, using the previous example of a month, in that month we had 25 assessments. This may be obvious to you, but it is impossible that each of those 25 assessments were the other 175 visits that came in that entire month. Just based on timing alone, that doesn't make a lot of sense. My point here is to say that this number has to assume a few things. It is not a direct measurement of how many times patients come in for treatment after doing an assessment. It is a direct ratio that represents, on average, how many follow-up sessions in comparison to assessments do we have in our schedule. Also, because this number is an average, the amount of time that is chosen to examine is of immense importance. When we have a lot of time that we're looking at, this number can be fairly reflective of what's going on, whereas it can be essentially meaningless if we look at too short a period of time. If we extrapolate the previous numbers that we looked at out to a year, where in 12 months we see 2,400 patients, with 300 of them being assessments and 2,100 being follow-up sessions, this gives us the same PVA calculation of 7. In this case, yeah, I would probably say that on average, patients that come into the clinic are seen for an average of 7 follow-up visits. This is a pretty legit calculation when we're looking at over 2,000 data points over an entire year. On the other hand though, let's look at 1 week. Let's say that in this week, you only see 1 assessment. In the same week, you do 40 follow-up sessions. This means that based on our calculations, we're going to have a PVA of 40. Now, to state the obvious, does this mean that in that week I saw my patients for an average of 40 follow-up visits? No, the sample size is way too small, so this number essentially becomes meaningless. All of this is to say that PVA is an average and not a direct representation of what is actually happening with patients. The amount of time that we take an average over is going to be very crucial. So it's important to keep both of these things in mind when we're talking about what these numbers are and what they mean. On that note, let's talk about what the numbers that we get actually mean for us as clinicians. A really low PVA, somewhere in the low single digits, lets us know that we aren't doing a lot of follow-up sessions in comparison to the number of assessments that we have. This could mean that, on average, most patients no longer need this practitioner's services after just a few visits. It could also mean that there are a good number of patients that aren't coming back after their initial assessment, which is going to drag down the overall average even if other patients are coming in for more treatment sessions. This could be because they didn't know they were supposed to book back in with that practitioner, or they didn't want to book back in with that practitioner. A really high PVA on the other side, somewhere in the upper digits, lets us know that we are not doing as many initial assessments in comparison to our treatment sessions, which could also mean a few things. It could tell us that this therapist keeps patients on their caseload for a longer period of time, in essence meaning they come back into the clinic more frequently after doing their initial assessment. It could also mean that this therapist just does not treat as often as other ones, and therefore having a lower amount of assessments and more follow-ups will have a higher PVA. Now, when we think about this critically, we can end up with some problems at both extremes. On the lower end, if we are a therapist who has a PVA of around 2 to 3, meaning that we have our patients come back on average for 2 to 3 sessions, but we'd like to have them coming in more around 6 to 7 times to get better outcomes with them, then this lower number is going to pose a bit of a problem because it means that we're not having as good of a follow-through with our patients as we'd like to. On the flip side, in the really high end of PVA, if we're a therapist who has a PVA somewhere that's like, let's call it 45, this could mean that this therapist keeps their patients on their caseload for a very long amount of time, which could represent a bit of a red flag in a profession that seeks to help patients through their problems and not keep them coming back in for services longer than they actually require. What's really important to keep in mind when we talk about both of these examples is that we're not talking about one patient, we're talking about averages. Using averages like this is an objective way to look at trends that are happening over your entire caseload, not with specific patient interactions. What this number means for you and what you should be shooting for in terms of your own clinical practice is very much not a one-size-fits-all recommendation. The context that you work in, the type of treatments that you provide, the patients that you work with, all of these things are going to impact what a good PVA or PVA that you'd like to see is going to be. How we analyze it and what its important is to your specific practice is something that only individuals can do in individual situations. So again, there is no prescriptive number that I think people should be looking for. This is exclusively a tool and a data point that you can use to examine your practice in a different way. If you've made it to this point in the video, thank you guys so much for watching. I truly hope that you enjoyed hanging out with me, talking about some numbers, and hopefully learning a little bit more about what PVA is and what it means. If you have any questions about this concept, other statistics, metrics, other money questions about physio and the business world, please feel free to drop them in the comments section for me down below. I will do my best to get back to you quickly, so I look forward to talking with you soon. But most importantly though guys, as always, move your body, have a laugh today, and I will see you at the next video.